Thank you, Senator Price. There are no lights on. Senator Campbell, you're recognized to close on your motion.
Thank you, Mr. President and colleagues. And I just want to make a point here before I make several closing comments, that the figures that were used by this are actual figures because the Department of Health and Human Services, and this is to help Senator Price on his question, the Department of Health and Human Services, we use their figures. And basically those figures came from those emergency labor and delivery figures, which would give us this population. I want to say that I very much appreciate the question about the charities and the faith community and the agencies, and they're providing that care. And that's very true. They stepped up over the last year. Physicians, medical facilities, all across the state of Nebraska. But one thing that I would like to add, and I very much appreciated Senator Paul's bringing forward the idea, and would encourage everyone to give a contribution. But in my regular job, what I call my day job, that's what I do, is I raise money for a charity. And I can tell you that that all sounds very well, but year after year after year, sometimes that donor's not there. The other thing we have to keep in mind is that the donor can designate what they want done with that money. So while I heartily encourage that, I also don't want my colleagues to think that only donors can help us through this situation. They cannot. It seems to me over the past year, 2 years, we've had more of a Band-Aid approach across the state to try to hold this together, to try to work very hard. If you talk to any one of those people in the clinics across, and as we traveled the state last week, they worked hard to just keep things going. But in the long term, we do, as the policy body for the state, we do have to make a determination on what our policy is in terms of helping healthy babies. One of the best parts about LB599, it's our plan. It's not the federal plan. The federal plan says you have the flexibility to deliver or to put your own plan together, and that's exactly what we did. And we put it very narrowly because our belief was in helping the unborn child have a healthy beginning, because in the long term, that's in the child's best interest, and that certainly is in the citizens of the state. 2 years ago, when I stepped forward and said, and asked that we lay the bill over, I made the statement that what many people across Nebraska saw as, quote, the right thing to do did not prevail. I'm asking today that it shall prevail, and with your resolve, we will override. Thank you, Mr. President.